We have our next presentation, which is a pleasure for me to introduce as well. The title of the presentation is Preliminary Monitoring of Ambient Particulate Matter Mass Concentration in Grenada. So now we're moving more into the environmental health field. The presenter is Dr. Mitchell. Dr. Mitchell is an assistant professor who teaches primarily in the environmental and occupational health track of the Department of Public Health and Preventive Medicine MPH program. He currently collaborates with research teams focused on the risk assessment and remediation of substrates polluted with toxic metals. He is also involved in research on exposure to ambient air pollutants and the related health effects. It is a pleasure for me to introduce Dr. Mitchell. And this paper is in collaboration with Dr. Ford, but I believe Dr. Mitchell will be the only presenter. Welcome, Dr. Mitchell.
Thank you very much, Dr. Gomez, for the introduction. And as mentioned, this is our topic today, air pollution. It's a very fascinating discussion to be had. And it is something that we have not paid much attention to in Grenada in many years, in fact. So this particular project is in collaboration with Dr. Ford, Dr. Smith, and some other researchers from a university in Ontario, in Carleton University. And together we are starting a process to collect data to help inform the current situation with air pollution in the island and in the region. So the first question is, what is particulate matter? And specifically, you would hear the designations PM10 and PM2.5. Well, PM10 is ambient particulate matter with a diameter between 2.5 and 10 micrometers. Now I'm showing my hand, but actually it's a lot smaller than this. If you look at the image on the screen, you can see that the strand of hair is orders of magnitude greater than the size of any one of these two types of particulate matter classifications. So PM2.5 is actually less than 2.5 micrometers. Now, we are not focusing on PM1, but in the coming years, it will become a much more important form of particulate matter, because these are particles that have a diameter of less than 1 micrometer. So really, really tiny pieces of matter. Now, of course, this particulate matter can come from anthropogenic activity, specifically combustive activities, factories and cars and so forth, but it can also come from natural or geogenic phenomena. And in fact, that is our principal focus, at least going into this research here in the Caribbean, because we are not very industrialized, so to speak, but we do suffer the effects of certain natural phenomena, including Saharan dust events that occur in the dry season. So particulate matter pollution is a very serious thing. Initially, when focus was placed on this type of material, the focus was placed on PM10, and that initial focus was on respiratory disease, because of course, PM10 is inhaled, it settles in the lung, and of course, it can result in all sorts of adverse respiratory outcomes. However, as we began to study PM2.5 and matter much smaller than that, it has come to the attention of scientists that these sizes can actually cross into the bloodstream. And once they do that, they enter into systemic circulation and they can initiate all sorts of inflammatory events. In fact, ultrafine particles in the bloodstream has been associated with enhanced platelet aggregation, for example, or endothelial cell activation. And that initiates inflammatory events on the blood vessel linings, and of course that would result in all sorts of atherothrombotic events. Another thing that's coming to the fore now is the effect particulate matter pollution, specifically 2.5 and smaller, has on cognitive impairment, neurotoxicity in general. So there are studies that are showing an association between particulate matter, small, PM2.5, PM1, and an increased incidence of Parkinson's disease, Alzheimer's, and other forms of cognitive decline. In fact, a year ago, a study was completed in China, and they measured cognitive performance on groups that they took from cities, moved them to rural areas and back, and they were studying the verbal test scores that they were applying to these participants, and they noticed that there was a significant decrease in cognitive performance after exposure to air pollution. And of course, stratified by age and so forth, it was more pronounced as you get older, and it was more pronounced in males. So it's a very interesting field that's being explored right now. And of course, this year, our focus is COVID-19. And what do you expect? Well, both PM 2.5 and SARS-CoV-2 are going to cause vascular endothelial dysfunction. They're both going to initiate inflammatory responses. So together, you're going to have a synergistic, if not, maybe at the very least, potentiation between the two toxicants in this particular case, and it would induce inflammation and lead to greater vulnerability and less resilience when faced with a SARS-CoV-2 infection. Very recently, this year, a couple of weeks ago, the GBD, that's a group of researchers, some 3,600 researchers, collecting data on premature deaths, listed air pollution as the fourth cause of death in terms of disability adjusted life years. That's the sum of years, the sum of years of life lost from early deaths or including disability. And of course, in this case, is disability due to paralysis or stroke as a result of air pollution. Air pollution is number 4. And they categorized in 3 main categories: ambient particulate matter, which is our focus today, household air pollution, and ambient ozone pollution. And some of the endpoints they were looking at are listed here in the other graph, where you see it's LRI, lower respiratory infection, chronic obstructive pulmonary disease, lung cancer, cerebrovascular disease, ischemic heart disease, and other forms of non-communicable diseases. So it is a very, very serious matter. Now, in Grenada, we have not been able to do much research in this area. A couple of years ago, it was started, and a researcher was able to confirm that indeed Saharan dust events, in conjunction with seasonal humidity, would exacerbate asthma. So persons who are sensitive to these types of pollutants are likely to see the effects. The problem is we did not have equipment at the time to collect this data, so the samples were actually taken from Barbados and estimated in the island, but it was a very valuable initiating piece of research that really highlighted some of these problems that we are facing here. And just, pictures are worth 1,000 words. This is what we look at. I mean, Grenada typically would look like this on the left side. Sometimes it may look like this on the right, doesn't it? Another picture taken from campus. It typically looks like this, but then again, sometimes it can look like this. Now, regardless of where this particulate matter pollution comes from, cars, industry, or Saharan dust, it is particulate matter. And adverse health outcomes are going to be equally adverse. Okay, here's another image that was taken. This is pretty horrible, isn't it? This is really, really poor air quality. This is my car, sad victim of the condition. So imagine this is settling on your vehicle. And what's happening when you inhale this type of material? See, it was very surprising, in fact, on one day where the weather forecast simply said dust, not cloudy or sunny, just dust. See? So what did we do? We collected data for a couple of months. We set up some sensors around the island, and I'm going to present data from one sensor, but these sensors take duplicate readings every 10 minutes. And so you have 2 sensors, each sensor takes duplicate readings every 10 minutes continuously. And it takes readings of different sizes and then algorithmically calculate the 24-hour mean. But you can get granular, as down as little as 10 minutes or by the hour. But we are going to use 24-hour means because that is what guideline values now require, that you take an average over 24 hours to estimate the impact it's going to have on your population. So this is an example of one of our sensors that has been installed in the airport. So these are some of the findings that we found. Sorry for that redundancy. The mean PM 2.5 levels, the concentration was 13.72 micrograms per cubic meter. The mean PM 10 was 16.49 micrograms per cubic meter. Now, this sounds like a very arbitrary number, but this number is actually higher in the case of PM 2.5 than guideline values, the annual mean that's recommended. And I'll talk to you about that shortly. But what we can see here from this data is that particulate matter concentrations vary greatly. See, because you can see there's a great range in both PM10 and 2.5, and the standard deviation is significant when compared to the size of the mean. But environmental conditions like temperature and humidity, these do not vary as much. There were no relationships or associations found between temperature and particulate matter concentrations, but there is an association between humidity and particulate matter concentrations, as we can see from this correlation matrix. And basically what we're seeing here is when you have high humidity levels, you are likely to have lower particulate matter concentrations. And that goes without saying, because from an atmospheric phenomena perspective, the Saharan air layer is extremely hot, dry, dust laden, and it's about 50% drier than typical tropical air. So it's the complete opposite of conditions you need for tropical storm activity. So when you have high dust activity, you tend to have low tropical storm activity and vice versa. So as you move into the rainy season, you're going to have less problems with dust and particulate matter in the atmosphere. So looking at some of the data on a graph over a couple of months, you can see it's quite noisy. There's a lot of variation in one day and a couple of days with this particulate matter, but using a rolling average to sort of estimate a trend, you can see it goes up and down. And when it goes up around the months of May, June, and July, these peaks actually correspond to days that we had Saharan dust events. Now, what are we seeing here for PM10? We're seeing that the mean for the year so far, even though the max is 41.69 on a 24-hour average, the mean is 16.49. And that means in the good news, we do not surpass the level that WHO has set for 24-hour mean, which is 20 parts per million, 20 micrograms per cubic meter. And for WHO, this number 20 is the lowest level at which cardiopulmonary and lung cancer mortality has been shown to increase in response to exposure to particulate matter. So if you're under 20, you're in a relatively safe zone. So for PM10, at least the annual average, we are good so far, but there are peaks that exceed that average. So it does suggest that there is something that we need to pay attention to. Days above the annual mean will be 69 out of the 243 days that were sampled. The story is not as beautiful when we look at PM2.5. For PM2.5, the mean set by WHO is 10 micrograms per cubic meter. Our average for the year so far is 13.72. So we are above that level at which WHO states that we are going to have some adverse health effects. What is more notable is that our maximum 24-hour mean is 38.72, which is above the 24-hour mean that is set by WHO, which for WHO is 20. So what we're looking at here is some serious problems with PM2.5, and PM2.5 is the size of particle that's associated with most adverse health outcomes. So it highlights the importance of paying some very close attention to this. It's noteworthy that on some days we have we have obtained readings of up to 221 micrograms per cubic meter. That is significant. In fact, to put that to something that we can more easily understand, we have an AQI, an air quality index, that takes our particulate matter readings and translates it to something that persons can understand, a number, and a unidimensional number that someone can understand. So if your app on your phone or the weather app you're seeing says under 100, it means you're okay. Between 50 and 100, it means you're in moderate. You have to be careful if you're sensitive, but you're okay so far. But as you go higher, it becomes more unhealthy. So with a reading of 221, we were in very close to the hazardous zone, weren't we? Nevertheless, our average is currently moderate, which is not something to sing praises about, because that level 10 establishes the lowest level at which there is an increase in adverse health outcomes. So these preliminary readings certainly inform us that we do have a problem. We are going to continue monitoring it. Right now, you can monitor this data if you're living in a large city. Your weather app can tell you what the air quality index is, and this is translated to something that we can understand: sensitive groups, older persons, these vulnerable segments of the population, and increasingly it becomes worse for more segments of the population as you go up in concentration. So in Grenada, we don't have this data being published in our weather apps, but you can go to Purple Air or Weather Underground, and the data we are collecting are actually being published there every day, so we can monitor our air quality. So what are our conclusions? Well, PM10 concentrations were below 24-hour mean guidelines set by WHO. 2.5, no. they exceeded the 24 mean guideline value on 20 of the 243 days. And the average so far exceeds the average that was set. So this means we have to continue monitoring. We have to expand our monitoring network, and of course, start some assessments to evaluate the effect this is having on our health status. So that's our plans going forward. This is just the start of a very interesting project, and we're hoping to collect data on health of the population and do some correlations. We have to do some characterization of the physical and chemical characterization of the particulate matter to know exactly what we are dealing with in terms of the type of particulate matter. And all of this should be very informative in helping us make decisions in terms of protecting our population from the ill effects of exposure to poor atmospheric conditions. So visit purpleair.com so you can keep up to date with your air quality readings. Thank you very much for your attention, and I'm willing to take questions.
Thank you very much, Dr. Mitchell, for that very insightful presentation as we understand another layer, another element of how we engage and examine the impacts of our health and well-being as well. A couple of interesting points from Dr. Mitchell. One is when you examine the trend spatially and temporally, if you were to compare that with respiratory cases in the geographical location of St. George's in Grenada that you alluded to, can you decipher or can you appreciate any discernible trend with the environmental presence and the objective health with adverse health issues?
That's a good question. And we can respond to this based on previously published data that certainly finds a positive association between poor air quality levels and incidence of certain respiratory diseases. Taking emergency room data, for example, there is definitely an association based on other studies. We expect to find the same thing here. The problem is this year, that data might be a bit cloudy because most people, if they're experiencing some sort of respiratory distress, may not want to go to the hospital to seek help. So we are going to collect the data, and the objective is to have these monitors going for a couple of years. We have a number of them going up in different parts of the island, the north and Carriacou, the south and so forth. And we expect that the data at least would clean up, in the coming years as this COVID pandemic settles down a bit, because that certainly would have, clouded the data a bit. But there is definitely going to be an association because it is something that has been seen in other studies that have been done around the world. Any
particular implications would you suggest for face coverings and the presence of particulate matter? I'm not speaking about N95 per se, but the recommendations are just these cloth coverings or face coverings. Can that reduce or can that increase the exposure potential and adverse effects? Yes, definitely that can reduce the adverse effects because you're going to reduce the amount of content inhaled. Now, interestingly, many of the countries in Asia, China, Korea, for example, in their larger cities, persons were accustomed to wearing masks on days with poor air quality, principally for that reason. And that is something that we may be a bit more comfortable doing now, based on our current circumstance. But they have a very long history of doing that, and it certainly does help reduce, potential exposure to particulate matter. It wouldn't eliminate it, but it would reduce the concentration of matter that's inhaled, definitely. Maybe we may need to revise how we report our weather as well over time. Definitely. And I think as we go forward collecting and publishing this data, it would help, public health dependencies give proper recommendation, especially for those sensitive populations. I know a few people anecdotally, we consider ourselves, and I'll include myself there, as bioindicators. We know when the air quality is going to drop, because as it does, then you start seeing the effects, the allergic effects. So certainly this would help improve recommendations for sensitive populations to protect themselves.